busy, if you have time to read only one paper about EMFs and neuropsychiatric disease, this is the paper that I recommend. So this is a 2016 paper by Martin Paul. Microwave frequency electromagnetic fields produce widespread neuropsychiatric effects, including depression. And this is a great paper because it's short. I know that sounds horrible, but people are busy. It's a short paper. It's got a summary table with 24 peer-reviewed papers on EMF-associated neuropsychiatric effects. And it's really clear and concise documentation of that EMF exposure was associated with a wide variety of neuropsychiatric symptoms. He also goes into mechanisms and talks about the effect that voltage-gated calcium channels have a near universal role in the release of neurotransmitters and hormones by neuroendocrine cells. Also, the EMFs act via downstream voltage-gated calcium channels, and they increase intracellular calcium, have effects on signaling with nitric oxide, and also increase reactive oxygen species. So we have other epidemics now in the US, and one of them is stroke in the young. So stroke occurring at age really below 45. Some people consider it below 65. But this is there's a lot of data on this. So George et al. In 2017 reviewed 2 large data sets with a combined N of close to 800,000 hospitalizations. And what they found was a significant increase in acute ischemic stroke hospitalization rates for both men and women. But for the men, the rates of acute ischemic stroke nearly doubled. And these are from the age groups 18 to 34 and 35 to 44. While at the same time, the stroke rates for older adults did not change. So, and this is again, it's not an isolated trend or one paper. This data is being, you can see similar things happening there are studies from other countries. So it's not just one paper. So stroke is like the new normal or something. We've got, support groups for people who, for stroke in the young. And there's even a magazine, I was shocked to see this, called Stroke Smart. So shocking. And, and the etiology, the reason for ischemic stroke in the young, it's cryptogenic in up to 50% of the patients. So they don't know what the cause is. So I'm